For our group program, we decided to do the Chicago Alliance to End Homelessness. It is formed through two programs that originally came together, and they are the Partnership to End Homelessness and the Chicago Continuum of Care. By these two organizations coming together, they were able to make more of an impact than they would have on their own. The Alliance brings together all of the essential ingredients for addressing homelessness in Chicago while removing duplication, coordinating diverse efforts, and optimizing the use of limited resources. Like most programs out there, this one has a mission statement and a certain set of goals that it wants to achieve. It has the mission statement of supporting, sustaining, and creating successful strategies to end the problem of homelessness that resides in Chicago. With the mission statement, there are 4 key strategies that are to be implemented. The strategies are implementing Chicago's plan to end homelessness, advancing policies to end homelessness, increasing public support for ending homelessness, and administering major state and federal grants. The goals of the Alliance are quite similar to the mission statement and fall in the lines with what the mission statement is trying to achieve. As stated before, it can be looked at as an all-around main goal that all the others are based and branched off of. By creating, supporting, and sustaining efficient strategies and effective plans to end the problem of homelessness that resides in Chicago, you come up with a multitude of possibilities and achievable goals to try and tackle. A second goal of the Chicago Alliance is for everyone to have access to a safe, decent, affordable housing and resources and support needed to sustain it. The goal is quite unique in the fact that it not only mentions the need for everyone to have access to housing and safe and affordable, but it also states that the job is not done because you need to keep supporting these same people with the necessary resources to help them sustain and keep their homes. Without the resources and support, this would be a never-ending circle of people getting off the streets and into homes and then losing those homes and getting back onto the streets again because they could not afford to keep them. A third goal is preventing homelessness whenever possible and quickly moving people who become homeless into permanent housing and help them stay there. This goal can also be referred to as the housing first approach. In this goal, it is also evident that the point is made that once people are moved into permanent housing, they still need to be able to remain there. The Chicago Alliance to End Homelessness has certain benefits and services provided through the program as well. To start, they have a homeless prevention call center that connects people in danger of becoming homeless with specially trained prevention staff. They also have people who are referred to as apartment finders that have the job of locating housing for households that can pay market rent or just below market rent. It also uses the Illinois Rental Housing Support Program, which provides rental support to house over 4,000 rent-burdened households across the state. It is also the nation's largest state rental assistance program. Another benefit is that the Alliance uses the St. Leo's Residence for Veterans. It is one of the first in the nation, and it provides 141 permanent housing apartments for formerly homeless veterans. It also has an outpatient clinic and resource center that is operated by the U.S. Department of Veterans. There is also a street-to-home initiative that moves people directly living on the streets into permanent housing that has successfully moved over 124 people. These benefits and services that were mentioned covered a lot of the ones that are offered, but there are still some more that the Alliance does provide. When it comes to eligibility criteria of the program, the only requirement is that you are currently homeless or are in danger of becoming homeless. The Chicago Alliance to End Homelessness does not discriminate by use of age, race, or gender, and they do not pick and choose who to help based on why they are homeless and how they got in this position in the first place. Therefore, to be eligible to help by this program, you have to be homeless or about to become homeless, can either be male or female, can be of any age, of any race, and can be homeless for any of the hundreds of reasons out there. The Alliance mentions that there are 3 different patterns of usage of the homeless system, and they are episodic, transitional, and chronic. Episodic is defined as individuals who shuffle between being in and out of shelters. Transitional is individuals who become homeless due to some sort of financial crisis that they encounter and can remain in a shelter for about 3 months and then leave and often do not return. Chronic is defined as individuals who have been homeless for at least a year or longer, or at least 4 times within the past 3 years, and is thought to be the main pattern that is found in shelters today. The Alliance also mentions multiple subpopulations that are found within these 3 categories that suffer hardships that make it hard to escape being homeless. Some of these subpopulations are immigrants and undocumented individuals, youth, who have been thrown out of their homes, ex-offenders, individuals who suffer severe physical or mental illness or persistent substance abuse, individuals who experience domestic violence within their homes, and veterans. Anyone who falls into any of these categories or any of the subpopulations is in a position to be helped by the Chicago Alliance. The Chicago Alliance also has funding that comes from two major sources, the HUD-McKinley Veto Fund and state homelessness prevention funds. The U.S. Department of Housing and Urban Development is the largest single source of funding for homelessness in Chicago. In 2010, HUD gave Chicago more than $54 million, and the funding helped support over 170 programs for homelessness families and individuals. HUD awards the Continuum of Care Homeless Assistance Grants through an annual application process known as the NOFA. It's the Notice of Funding Availability, which is typically released by HUD in the spring or summer of each year. The second source of funding is provided by the Illinois Department of Human Services. They provide funding for the prevention of homelessness through its Homeless Prevention Program. These funds are the key to helping many individuals and families avoid losing their housing and becoming homeless. Specific uses include rent, utilities, security deposits, and supportive services to prevent homelessness. Another positive outcome of this program is that it helps people who use it to come in contact with other resources like food stamps and assistance with energy costs.
There are 4 levels of administration within the Chicago Alliance. The first one is the federal level, and the federal level actually works with a program from the National Alliance to End Homelessness, which is called the Substance Abuse and Mental Health Service Administration. This program provides funding for several programs that provide services to people experiencing or at risk of homelessness. The SAMHSA provides case management and other supportive services like outreach, mental health services, substance use counseling, healthcare that are all linked to housing. It's an integrated program that is highly effective and cost efficient. Between 2005 and 2008, the number of chronically homeless individuals decreased by 28% nationwide with the help of the Substance Abuse and Mental Health Service Administration. The Chicago Alliance is an has institutional principles because it offers a lot of different types of civil society organizations, such as charitable organizations, advocacy groups, political parties, think tanks, and virtual communities. It is a universal design because the criteria to be eligible for help and services only require that a person is either homeless or at risk of becoming homeless. It is public because the Illinois Department of Housing and Urban Development and the Illinois Department of Human Services provide funding for this program. The program meets the policies defined in the National Alliance to End Homelessness because the NAEH focuses on chronic homelessness, families, veterans, and youth. And the Chicago Alliance has opportunities for people in each of these focus areas to receive help with its goals of the mission statement of the Chicago Alliance to End Homelessness. The Chicago Alliance helps greatly with alleviating the issue of homelessness and reducing the number of homeless mentally ill in Chicago, as well as other categorical issues regarding homelessness. For example, because people experiencing homelessness are more likely to access the most costly health care services, they are costing taxpayers about $2,414 per hospitalization. With programs like the Chicago Alliance, the funding they receive help field other programs to help with the cost of healthcare services. There are many programs that on the local, state, and federal level help assist with homelessness in Chicago. However, there is much more to do. The Chicago Alliance to End Homelessness was a big advocator in January of 2012 to help revamp the 10-year plan to end homelessness set forth by Mayor Daley in 2003. The plan has not accomplished its goal yet, but it has produced many avenues to the homeless with accessible long-term supportive housing and social services. The number of supportive housing units in Chicago has increased by 88% from since 2003, from 3,598 to 6,779 participants. But those are not nearly enough to house the city's estimated 94,000 homeless. Chicago is currently working with multiple agencies and providers and sources of financing to create a better system that will move people from shelters to permanent housing. The new plan will hopefully have an easier application and a centralized waiting list, as well as the social service call center, which the Chicago Alliance to End Homelessness actually has, and it gives services. It gives a direct call line to help with social service resources to homeless people. With all the history in homelessness and the specifics on the mentally ill homeless, we can have a better understanding of the problem and how Chicago can continue to create programs, services, and resources that will eventually end homelessness here.